With a broken foot, split lip, cut nose and a strained wrist, a Hobart woman says her 78-year-old mother-in-law was in desperate need of medical care, only to be told she was too old to be admitted to the private hospital. Sheree Morriss said her mother-in-law, who asked to remain anonymous, had been paying for private health cover for years. But when an ambulance took the 78-year-old to the Hobart Private Hospital, HPH, after a nasty fall, she was turned away. Ms. Morriss said the hospital initially told paramedics to bring her mother-in-law in, but upon arrival, staff at the hospital said it was outside of their protocol to treat her. The staff definitely said that one of the reasons was because she was over 65, Ms. Morriss said. This is a lady who is close to 80, bleeding all over her face. She was quite shocked at the time that they were turning her away. Who are they servicing? Do you know more about this story? Contact TASS in depth at ABC. Net.au Ms. Morriss said it was appalling her mother-in-law was made to feel worthless of treatment due to her age. Having a nasty fall is one thing, but to be turned away because you're too old, it's just atrocious, she said. I thought, who are they servicing? The elderly form a large part of our society, and they should be treated with respect and compassion. Photo: Hobart Private Hospital says it provides care to residents of all ages. ABC News: Ms. Morriss has since lodged an official complaint with the hospital on behalf of her mother-in-law. In the complaint, she writes, the ambulance pre-checked with the hospital prior to taking her and were told to bring her in. The hospital said it had opened an investigation into the case. It told the ABC refusing patients due to their age was not part of its policy. Our hardworking and dedicated staff, doctors and nurses are committed to providing high-quality care to Hobart residents of all ages from newborns to the elderly, a spokesperson said. Complex case is not financially rewarding, however, a senior clinician at the Royal Hobart Hospital said the public hospital was regularly taking in patients with private health cover. Today, I think it was over 6 or 7, not necessarily elderly, but patients with private insurance who are having to go through our Royal Ed. Dr. Frank Nicholson, chairman of the Royal Hobart Hospital Staff Association, said. He said private hospitals should aim to take pressure off public hospitals that are already stretched to service patients. There also hasn't necessarily been enough forward planning by the private hospitals to have the medical staff available to provide the complex assessment and management support that those patients need, he said. Andrew Brakey from the Australian Nursing and Midwifery Federation also called on the HPH to look at the service they're providing. These are good people of Tasmania, who've actually paid for their private insurance, and now they're getting turned away at the private hospitals, he said. I'd be hoping that the Hobart Private is actually looking into this to see what is going on and would be looking to make sure these patients are admitted and receive the care that they require. Contact Kotri Yubu. More stories from Tasmania.